Hello again, it's Harry here, your geriatric nurse from Toronto, Canada. Back for my humble contribution for the care for the older adults and their caregivers. Tonight, I just wanted to briefly discuss a little something about different phases of confusion that I see in my practice. And again, as an overarching guide, I'll relate them to the triple Ds: delirium, depression, and dementia. When we see a confusion in the older adults, it's always important to know when the onset is, because then you'll be able to differentiate which amongst the triple Ds is in play. So again, for delirium, it's an acute change, and for depression, dementia, usually it is a chronic change. Sometimes with depression, it can also be an acute confusion. Say, for example, if there is mental health breakdown because of mood burden over time. Um, no matter where the source of the confusion is, always utilize your most important tool that you have, which is yourself. You have to use the therapeutic use of yourself, which means you actively listen, try to address what they're trying to say. First go to is to reorient, but if you find that they are that it's triggering to them, then you pivot to doing reassurance and validation. Validation, which means living in the reality. um, when someone sees an older adult, sometimes there is a misconception or false belief that they already are confused. And that's a stigma that the older adult, some of them have. And as a professional, especially as a professional caregiver, professional health care provider, you have to be very cognizant of that and make sure that that stigma do not affect the care that you provide, especially when you're in acute care setting or any setting you are in. Always make sure find out when the onset was, because again, in the triple Ds, you want to be able to find out things early so you could reverse the reversible and manage the manageable. Thank you so much. And again, do not self-diagnose. Reach out to your primary care providers. Hope you guys are good. Take care. See you next week.